Hello, and welcome to Ask Dr. Dora. I am Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora podcast is my virtual medical ministry that's all about addiction medicine, substance use disorders, and the magnificent bodies we live in, where I always say knowledge is power. The more knowledge we have, the more power we have to take better care of our bodies for improved and hopefully optimal mental and physical health. Today we talk about the epidemiology of marijuana. Epidemiology is the study of the distribution and determinants of disease or disorders within groups of people. Marijuana use peaked in the 1960s. It is the most widely used illicit drug in the United States. In 2024, 24 states, along with the District of Columbia and Guam, had legalized cannabis or marijuana for non-medical use by adults aged 21 and older. 3 in 10 people who use cannabis have a cannabis use disorder. The self-reported cannabis use has been increasing for years. More states are legalizing it, and marijuana has been legalized for non-medical use, even though there is a large scientific gap in the knowledge about it and its potential risk versus its potential benefits. So you ask, why legalize cannabis? Legalizing marijuana brings in revenue. It is safer than alcohol. There have been no deaths caused by marijuana alone. There's a poor use of the criminal justice resources, prosecuting or arresting people for marijuana. A criminal record causes lasting harm for housing and getting jobs. Cannabis laws unfairly enforced, according to the ACLU, where Black people are more than 3 times as likely to be arrested for possession than white individuals nationwide, despite similar rates of use. The prohibition of marijuana or anything breeds violence. Regulation allows for control in decreasing the risk of contamination by dangerous pesticides, molds, bacteria, and lacing with other drugs. There is concern about the potential risk associated with young people using cannabis. The risk of developing cannabis use disorder is greater for people who began to use it before age 18. Cannabis use directly affects the parts of the brain responsible for memory, learning, attention, and decision making, coordination, emotion, and reaction time. When I was in practice, I had a young man, he was 16 years old, and I was questioning him about his marijuana use, and he just started to cry. I was like, oh, what's wrong? He said that he had forgotten his multiplication table because he learned it when he was high. Infants, children, and teens have developing brains and are more susceptible to the adverse effects of cannabis. Long-term and frequent cannabis use has been linked to increased risk of psychosis or schizophrenia in some users, especially those under the age of 25. Cannabis is involved in more emergency room department visits for children, teens, and young adults since 2020. And women or females are more likely to have an adverse reaction to marijuana use than men. 20% of Americans believe marijuana is not addictive, and 29% believe It can prevent health problems. Adolescents are much more likely to develop a cannabis use disorder than adults, again, because their brains are still developing. There is some research that's proven some of the benefits of marijuana use. Chemotherapy induced nausea and vomiting. There is complete resolution of the symptoms. With neuropathic pain, there's a 30% reduction in pain and spasticity from muscular sclerosis. There's 30% improvement in palliative pain and a 50% reduction in seizures in those people that have refractory seizures. Spasticity from spinal cord injury shows a 30% improvement. Cannabis has an upside and a downside. Knowledge is power. So arm yourselves to make sure wise decisions are made based on what you know. To learn more, subscribe, listen, and share Ask Dr. Dora podcast on YouTube. Tune in again for more information on substance use disorders. I am Dr. Dora Dixie. Thanks for watching.